Good morning from Ioannina, Greece. Dear colleagues, first of all, thank you for your kind invitation. You give us the opportunity to share with you how we bring compassion to healthcare and to present you an innovative training program which was designed by Vassilios Kiosses and it is applied at our medical school, University of Ioannina, Greece. I am supervising the project and let me now introduce you Vassilios, who will give you further detail. Thank you very much.
Caring and compassion are key elements in healthcare which are mostly expected by patients and public in general. Compassion is a cornerstone in healthcare system, although we need to separate compassion from empathy. If compassion is when you feel sorrow for someone's suffering, empathy goes beyond. Empathy is the ability to deeper understand that feeling and experience it in a non-judgmental way. When you sympathize with someone, you have compassion for that person, but you don't necessarily feel these feelings. In our medical faculty at the University of Ioannina in Greece, we're trying to get closer to the patient by exploring all the aspects of the disease the patient suffers from. This stems from a person-centered approach to patient, which relies on empathy. Empathy creates a whole new perspective in healthcare where physicians try to see the world through the patient's eyes. In our medical faculty, we developed a 60-hour experiential empathy training called Empathize with Me Doctor. The Empathize with Me Doctor project is based on the principles of the person-centered approach and seeks to embrace not only the physical symptoms of the disease, but all the emotional and psychosocial aspects as well. Through several experiential exercises, medical students try to develop this virtue by interacting within group while exploring the way they relate to others. Theory, personal growth, and skills development are the basic modules of the Empathize with Me Doctor project. 3 groups of 12, 14, and 16 medical students, 42 in total, have been trained so far with more than positive results in empathic performance. The Empathize with Me Doctor project got the approval from the Deanery of the University of Ioannina, and now it is an elective course in our medical faculty. The Empathize with Me Doctor project teaches students to be more open to their experience during their relationship with their patients and to avoid classifying patients into predefined forms. Empathy is a revolution in healthcare, perhaps the 21st century revolution, and if all the healthcare professionals could act in an empathic way, a more effective healthcare system would appear. Effective for the patients and the physician as well, if we consider the fact that empathy is linked with more accurate diagnosis, patients' compliance and satisfaction, more accurate identification of somatoform symptoms, fewer burnout effects, and much more. It would be of an exceptional interest if we could hear some of the trainees who completed the Empathize with Me Doctor project. Panagiotis and Chrysoula have something to share.
I'm Chrysoula. My participation in this program was a life-changing experience. I learned how to listen, observe, and pay attention not only to our patients' symptoms, but also to their fears and concerns without judging them. I never knew that being empathic was so valuable, but finally my everyday practice proved me its importance and effectiveness.
Hello, my name is Panagiotis. Taking part in this empathy training was an experience totally different of what we are used to in our medical school. During the training, I realized that it has to do with my everyday social interactions, like with my family and my friends. The improvement of the ability to empathize comes out with a simple conversation. Empathizing can help me reach the right diagnosis, but also approach the patient with dignity and respect. Well, that's what happens to me when it goes for the doctor, and just because of that, I feel more than inspired to exercise empathy and spread the word about this unique way of approaching patients.
We would follow Hippocrates. He stated that some patients recover because they believe in their doctors. In order for a patient to trust and believe the physician is a condition full of empathy and unconditional positive regard. This training fills a gap. If we consider the fact that most doctors don't even ask their patients what scares them or if they're anxious about their health outcomes. This training embraces all the emotional context coexist with the suffering. Only if we believe that we are relating with persons and not with patients, a greater miracle could happen.